Yesterday, I met a colleague who said that she'd been to see a specialist performing endovenous laser treatment in Southampton, and it was performed under general anaesthetic. She asked me whether I ever performed endovenous laser under general anaesthetic, and I said to her, without exception, no. Now I'm going to tell you the reasons why. First of all, general anaesthetic is just not necessary nowadays for modern treatments. Modern treatments are performed under a local anaesthetic as a walk-in, walk-out procedure. So although general anaesthesia is safe, you can avoid any risk of general anaesthesia nowadays and have your veins done under local. Things like heart problems and breathing difficulties after general anaesthesia are simply eliminated by having your veins done under a local anaesthetic. Now, the second reason is that a general anaesthetic renders the person unconscious. They're completely paralysed and immobilised, and their legs do not move at all. Now, we know that blood flows in the deep veins mainly with movement. The muscles contract, they squeeze the deep veins, and that keeps the blood flowing in the deep veins. Now, under general anaesthesia, because there's no flow, the blood is more liable to clot, and deep vein thrombosis after general anaesthetic is a real issue. Under local anaesthetic, the person can be moving most of the time, they get up quickly afterwards and walk around. So I've never seen a deep vein thrombosis after an endovenous laser treatment, and I think it's because under local anaesthetic the blood flow in the deep veins is much better. Now, the other reason I avoid general anaesthesia is that very occasionally the laser treatment or the treatment for the varicose veins themselves, the phlebectomy, can irritate nerves. Now, even under local anaesthetic, this will cause some discomfort. And that's important actually to know, because if the person is having a vein treatment under local anaesthetic and it's uncomfortable, then it warns the surgeon that the nerve is being irritated and that he ought to stop doing it, either put some more local anaesthetic in and protect the nerve from injury and irritation. Nerve injuries, which can be quite serious, are only reported under general anaesthetic. I've never seen, and I don't know of any cases where a serious nerve injury has been caused by a treatment under local anaesthetic. In addition, when endovenous treatments by laser were first introduced, skin burns were an issue. Now, part of this was the fact that the surgeons performing the techniques had little experience because it was new, but also because under general anaesthesia the laser can damage the skin without obviously causing any pain. And if the laser is too near the skin under a local anaesthetic, the patient will feel discomfort. And again, this will warn the surgeon that they need to put more local anaesthetic around the vein to push the skin away and to protect it from any injury. So injuries, nerve injuries, skin burns, are almost impossible under a local anaesthetic. It's much safer. Under local anaesthetic, the recovery is very quick. People typically get off the couch and go about their normal activities very quickly. They're not recovering from a general anaesthetic, they're not feeling groggy, they're not feeling nauseous. So they feel clear-headed and they're able to get on with their life very quickly. Now, I know why some people would rather be out for their vein treatment. They're anxious. They're anxious that they're going to find the procedure unpleasant, and they're anxious that it's going to hurt. Now, it's very important that surgeons who undertake these treatments under local anaesthetic are mindful of this. We always, in our clinic, perform the treatments with plenty of time. It's very unrushed, unhurried. We'll allow plenty of time for the local anaesthetic to work, and we'll make sure that you are comfortable at all stages. And this will reassure you and allay your anxiety and fears. I've never had anyone who has had their procedure done under local anaesthetic and who said, well, actually, in retrospect, I wish I'd been put under. It simply doesn't occur. Universally, they say, well, that wasn't as bad as I was expecting, and I'm glad I had it done under a local anaesthetic. Well, I hope you found this video of interest. If you have, do please remember to click the button above and subscribe. That way you'll be amongst the first to see my next video. And I'd love to hear from you. If you have any comments, do please leave them in the box below. I'll try and get back to you as soon as I can. Thank you for watching my video.